Great, thank you very much, Harvey. Excellent points. So our next panelist is Gabrielle Fitzgerald. Gabrielle is founder and chief executive officer of Panorama, an action tank dedicated to help solve global problems. She leads in the area of innovative approaches and comes with a wealth of experience in global health, working on Ebola program, a huge program at the Paul G. Allen Family Foundation, also on HIV/AIDS and malaria and other challenges. So look forward to hearing your thoughts and insights.
Great. Thank you, Rima, and thanks for this great workshop. I'm going to talk about how to approach this from a bit of a different angle. As Rima just mentioned, my background is in philanthropy, politics, and government. So I'm always thinking about how we can make the political change that we've been talking about. And in all my career, I've spent time thinking about that related to malaria, polio, HIV/AIDS, and that actually makes me really optimistic that I've seen significant change happen over the course of my career, and I hope that we can begin to see it in this area as well. So I believe that if we make a very concerted effort to develop a political strategy related to microbial threats and outbreak preparedness, that we can make progress, hopefully well before 2042. Maybe we'll prevent you, Harvey, from doing that next report. So I'm going to tell you a little bit about my background and some of the work that I've done, which gives me this sense of optimism. Because I've seen how when a health issue is prioritized politically, it can create a sea change in how we think about solving a problem. So when I first started working on HIV/AIDS at USAID in 1999, USAID was the largest funder of global AIDS programs. And I remember very clearly writing the press release where we doubled the HIV/AIDS budget from 100 million to 200 million, which was a really big deal at that time. And then, of course, a few years later, President Bush announced PEPFAR with the mind-boggling commitment of $15 billion. And that happened because there was a concerted effort to put that on his agenda. And, I think it worked perhaps better than people had hoped. Likewise, we've seen funding for malaria increase dramatically with the funding of the President's Malaria Initiative. And I've also worked on resource mobilization strategies for polio, Gavi, and CEPI that have resulted in billions of dollars in new funding being raised for these issues. And so I really believe that when the right political forces align, major change can happen. So how do we make that happen on this issue? I use the term health diplomacy and define it perhaps a little bit differently than some others, because I define it as finding ways to incentivize governments to achieve health goals. And it recognizes the fact that public health is inherently political. Now, often when we hear the word diplomacy, we tend to think about the role of governments. But I believe health diplomacy goes beyond government officials and it includes all kinds of actors such as philanthropists, the private sector, and celebrities. And it can also take a really wide range of forms, from splashy public campaigns to private behind-the-scenes conversations. So how does this relate to readiness for microbial threats that we're talking about today? So I believe that to ensure we are prepared, we need a sophisticated health diplomacy and advocacy strategy to raise these issues on the political and financing agenda. Over the past 2 days, we've heard from a variety of experts, but we haven't engaged political leaders to come talk about how we can partner with them to move this higher on the agenda. And while this workshop may not be the right forum to do that, we do need to make a concerted effort to be thinking through a political and advocacy strategy to make progress on a preparedness agenda. The U.S. remains the largest funder of global preparedness capacity, and we need to ensure they stay that way and hopefully work to build on it. Now, some of you here may not think that's possible in today's environment, but there are other countries that can play leadership roles, and we should think about how we can work with them to do that. Philanthropists are another key actor in making change happen. In my work at the Gates Foundation and Paul Allen's Foundation, we made a deliberate effort to leverage our philanthropic dollars to encourage others to act. Let's take the creation of CEPI as an example. I had the privilege of working with the founding partners of CEPI while it was in its incubation phase. And I saw that the leadership of Norway and the Wellcome Trust, through that leadership, we were able to raise an initial $540 million that was announced at CEPI's public launch at the World Economic Forum in Davos in 2017. So this is what I would call a catalytic coalition. This morning, Julie Gerberding called on us to break down the silos and work together to build a strong coalition. So what if we brought the collective efforts of people in this room, along with the work being done by companies through the World Economic Forum, the Global Health Private Sector Roundtable, along with civil society, philanthropists, national security leaders, all together in a single coalition? Could that help us accelerate the pace of change? So if we were to develop a political strategy around outbreak preparedness, what would we be advocating to change? I think the recommendations of what we would do are very clear to all of us in this room today, as has been pointed out repeatedly, because they've been the same since 1976, and SARS and H1N1 and Ebola, the recommendations are almost verbatim. In 2016, I was pleased to be a co-author with Suri Moon, Steve Morrison, and a number of others on a paper published in the British Medical Journal that summarized the areas in need of improvement across all the post-Ebola panels and commissions. And earlier this year, Suri and I revisited the analysis to see what progress had been made. We reviewed 8 areas: leadership and monitoring, financing, national health systems capacity, WHO's role, the humanitarian aid system, R&D of health technologies, knowledge sharing, and trade and travel restrictions. And we found significant improvement in 2 areas. WHO's preparedness and response capacity has significantly improved with the creation of the Health Emergencies Program. And the creation of CEPI with significant new funding is significant progress toward developing new vaccines. And as we've discussed throughout this workshop, there's been great progress in the number of countries completing JEEs. However, many fewer of the plans have been costed, and there's little financing available for countries to implement the recommendations of the JEEs. And in most of the other areas, progress is incremental or very limited. The paper goes into great deal on where the gaps are. So I believe we need a political strategy to raise these issues on the political agenda. And we need to make sure we're not only having these conversations where we're preaching to the choir. We need to reach out to the broader global health and national security conversations. So let me give you a few specific things about what I would advocate for. So first is leadership. And while, as I just said, WHO has significantly improved their capacity to manage outbreaks, they're not positioned to respond to a global crisis or pandemic, as we've been discussing. I believe the UN Secretary General needs a standing mechanism to prepare for and coordinate across all areas of a response. Another tool that does not exist is a coordinated planning effort. So we're fond in the global health community of saying what gets measured gets done. However, we don't have an overarching global action plan that articulates all of the areas I listed above to be strengthened and regularly tracks progress. That may be the role of the new Global Pandemic Monitoring Board, but the jury's still out on that. And of course, underlying all of this is the need for increased and sustained funding. This morning, Ambassador Kolker talked about the G7's commitment to support 77 countries with their JEE plans, but there's been no published information that we have been able to find through our research that shows that that commitment has been turned into action. So there's need for advocacy to encourage that to happen. There's also the need for WHO funding to support their overall operations as well as the contingency fund for emergencies. And finally, as has been mentioned a couple of times, we need more funding for R&D, particularly to develop new diagnostics. As I understand it, CEPI has created a diagnostics window, but there's only minimal funding to date. So, in conclusion, Peter Sands talked this morning about behavioral economists and the people's tendency to be overly optimistic. So I guess I would put myself in that camp, because I am optimistic that if we invest in health diplomacy and advocacy, we can make progress in breaking the cycle of panic and neglect. And I'm going to end with a quote from Larry Summers, who said, "Of all the issues before us, pandemic and epidemic are the issues with the highest ratio of global seriousness to policy attention, that relative to its significance for humanity, there is no issue that gets less attention." So I hope we can work together to change this ratio. Thank you.